In the 1990s, high prevalences of infection with T lymphotropic viruses types 1 and 2, HTLV1 and HTLV2, were detected in individuals with human immunodeficiency virus in São Paulo, Brazil, in association with intravenous drug use, but the current prevalences of these viruses are unknown. Notably, HTLV infection can affect the progression of co-occurring diseases. Therefore, in this study, the authors aim to determine the prevalences and risk factors for those co-infections, as well as the optimal method for detecting HTLV infections in these patients. The current prevalences of HTLV1 and HTLV2 in HIV patients in the area were found to be low. The risk factors included female gender, black Pardue color, hepatitis B and C virus infections, and intravenous drug use. The authors suggested that the low prevalences were likely due to programs providing intravenous drug users with sterile needles and the decreased injection of cocaine, although this decrease was accompanied by the increased smoking of crack cocaine. They also found that the combined use of PCR and immunoline assay seemed to be the most effective method for detecting HTLV. The findings in this population are likely translatable to other populations, in which similar studies may be performed, and these results demonstrate the benefits of the needle program in this region. The low prevalence of HTLV identified suggests that less focus may be placed on this condition by clinicians treating HIV-infected patients in this region. Current prevalence and risk factors associated with human T lymphotropic virus type 1 and human T lymphotropic virus type 2 infections among HIV/AIDS patients in São Paulo, Brazil, a cross-sectional study led by Adele Catarino de Araújo at the Immunology Department, Instituto Adolfo Lutz, Secretary of Health of São Paulo. Like the retrovirus HIV, human T lymphotropic viruses types 1 and 2, or HTLV1 and 2 for short, are single-stranded RNA viruses that infect individuals via sexual intercourse or exposure to contaminated blood, and then proceed to replicate in their host cells. HTLV1 infection is associated with an aggressive blood cancer and a chronic spinal cord disorder, and HTLV2 has been detected in similar neurological disorders. Co-infection with HIV can accelerate the progression of AIDS and other associated diseases. In Brazil, an estimated 600,000 people are living with HIV, and an estimated 300,000 to 800,000 are infected with either HTLV1 or HTLV2, the highest prevalence in Latin America. Studies in São Paulo in the early 1990s identified 13% co-infection associated with intravenous drug use. The investigation by Catarino de Araújo and her colleagues suggests a much narrower overlap of 3.11%, evenly split between HTLV type 1 and 2. The researchers tested 1,608 HIV-infected patients attending the AIDS STD Reference and Training Center in São Paulo for HTLV co-infection using enzyme immunoassays, immunoblotting, and real-time PCR techniques. The current low co-infection rates reflect measures introduced by the Brazilian government in 1989 to control the spread of HIV from intravenous drug use, as well as an overall shift from injecting cocaine to smoking crack cocaine. Risk factors for co-infection were female gender, black or mixed race color, older age, intravenous drug use, and hepatitis B and C virus infection. The higher prevalence among women could be explained by engagement in unprotected sex in exchange for drugs. The researchers are currently working to refine their techniques for detecting HTLV infection among HIV/AIDS patients and apply them to centers across São Paulo.